This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2022. Bone sarcomas are rare malignancies that account for 0.2% of global cancer cases and about 5% of cancer cases in children. Most clinical guidelines recommend centralized care for patients with this cancer, as this helps to improve treatment quality and reduce costs. However, the relationship between geographical access, institutional treatment volume, and survival in patients with bone sarcoma remains unexplored. To address this gap, researchers used information from the U.S. National Cancer Database to examine the relationship between travel distance and survival among 8,432 patients with bone sarcoma diagnosed from 2004 to 2015. The analysis indicated two things. First, patients were more likely to survive at high-volume facilities compared with low-volume facilities. Second, patients who traveled 50 miles or more for treatment, about 53% of whom traveled to a high-volume facility, had a higher survival rate than those who traveled 10 miles or less, of whom only about 18% made it to a high-volume facility. The researchers thus concluded that pursuing centralized treatment at specialized high-volume institutions, even though this increases the patient's travel burden, significantly improves chances of survival in patients with bone sarcoma. Therefore, it is imperative that patients and caregivers consider these findings before choosing a treatment center.